Hey, welcome everybody to today's live stream called Neuro Home, empowering recovery from the comfort of your own home. I'm Dr. And for about, I would say, the last 4 years, I have been almost obsessed with the idea of how can we empower patients to do more home therapies. And so it was going to require a total paradigm shift in the way that I have practiced for over 36 years. And it really started with a patient called Nicole. So I want to tell you about Nicole's story. Nicole came to me and she had plantar fasciitis, woke up one day and could barely walk. And so we brought her in, and we had been very successful with a new direct current electrical stimulation that we call ARP neurological therapy. And there's two units. There's the RX unit, which is for clinical, and then there's the home unit, which is PRS, or ARP Wave is another manufacturer, and theirs is called the Flex Doctor. So Nicole was coming in, and I was seeing her 3 times a week. That's the best that she could do. And she was getting foot bath. And that's where we do the treatment. And the first goal is to get the pain taken care of right away. Well, it took about 12 to 13 visits, and that spanned over 2 months because Nicole owns a flower shop and she's a business person. And sometimes she just couldn't make it in on that 3 time a week basis. And she said, I wish you guys had some way that I could do the therapy at home. And at that point, I really kind of felt like an idiot, to tell you the truth, because I had 5 of the home personal recovery system units that I had purchased, and we're using it for exercises down in our rehab area. It never dawned on me to dispense these for home use so a patient could be getting the therapy every single day, multiple times a day, from the comfort of their own home. And so that's what we did. And you know what happened? She got better right away because we were jamming the therapy in there at her convenience. And again, multiple times a day. So that got me to thinking, okay, if I can do that for plantar fasciitis, what other conditions could I take and expedite the treatment with? How could I actually see patients less and still get great clinical outcomes? And that was the challenge because chiropractic is a hands-on profession, right? And so how do you do that? How do you take a hands-on profession and say, you know what? Maybe you don't need as many manipulations. Maybe the adjustment isn't the be all that you need. And as a matter of fact, I would argue that knowing what I know now compared to back then, I would say, well, you know what? Um, the adjustment isn't everything that you need. And I know that any chiropractors that are listening to this are going to say, this guy's a sellout, he's blasphemous, all that. But you know what? I don't care because the last 3 years I have taken and I have performed tests. I've used my clinic as a laboratory for patients. And you know what has happened? Because I have cutting edge therapy, I'm able to get the patient in and I'm able to shave off weeks and days and months of care and then get them outfitted with a home therapy unit so they can do it in the comfort of their own home. So Nicole had a wonderful outcome. And I'm going to come back to her in just a little bit because we had another situation with her. There is another electrical stimulation that I use that is called BioWave. BioWave is the stimulation that blocks the pain transmissions from getting into the spinal cord. And so I have Christopher. Christopher has been a longtime patient. He is a chronic disc patient. So before I got this therapy in, it would take easily 18, maybe sometimes 20 or more visits to get his flare up of a disc calmed down. And when I say flare up, I mean he had the rigidity, he was afraid to move, he had the pain going down the right leg, the whole gamut. Did not want to have any kind of surgery, didn't want to have any kind of epidural injections. He wanted to treat this as conservatively as possible. So I have a table called Cox Flexion Distraction, and we use that here in the clinic. And after I would say about his third episode over a period of 10 years, I finally had brought a BioWave, and there's the Pro model, which is for the clinical, and then there's BioWave Go, which is for home use. And this is what I do on all my acute patients. So instead of having them come into the clinic when they can barely walk or they're in such pain, I send them home with the BioWave Go. And I say, okay, here's the instructions. For Christopher, it was stay down, get the BioWave on, use it every other hour, get up, obviously walk around a little bit. And then when you can move better without excruciating pain, then I'm going to see you in the clinic. It's really my version of, I would say, pain medication. It's in, and the patients love it. I had another patient, Gabe, that came in actually 2, 3 weeks ago on a Friday, and she had a terrible torticollis, could hardly move her neck. And I got her set up with the BioWave Go because I was going out of town that weekend. I got her set up with that. I saw her again the following Monday. She had used it all weekend at home, and by the time I saw her Monday, she was probably 75% better. So what my goal now is for patients is to not see them as often. I want to get them out of pain just as quickly as possible. And then I want to get them going into home-based therapy because I always hear throughout the years, I've always heard, hey, Dr. Arkfield, what stretches can I do at home? What exercises can I do at home? Now, I know patients mean well when they ask that, but I also know I can run off sheets of stretches for them, and I know they won't do it. They just won't do it. They'll take them, and chances are I'll probably find them in the garbage outside the clinic. Or if they do decide to do it, how do I know that they're doing them correctly? How do I know that they're not doing abnormal movements, moving away from the pain and just not causing more problems? So once we started to use the art neurological therapy, we could take and have them come in once a week or twice a week. And I could make sure that they were on the big unit at that point. And just to let you know what this really is. So I said it's a neurological stimulation. It produces 500 pulses per second. And so our bodies are made up of receptors. And the typical one that we need to really initiate and engage is our muscles. What I'm seeing is a lot of patients that have weak glute muscles, weak butt muscles, and that just sets the tone for a problem with the lower back and even on up. So I can take and have them do exercises, targeted exercises with the PRS unit, and they can get tremendous results at home. And then I can monitor them when they come back on the weekly basis or 2 times a week if that's needed to make sure they're doing the homework properly. I can also check and see if we need to move the pads and have a different pad placement for them. So with Christopher, we got him on the BioWave Go and then brought him back and started doing art neurological therapy so that we can strengthen up. There's deep down muscles. They're called the multifidus muscles for the disc pain patients. And we've got to get those stabilized. We got to get those turned on. We also have to engage the glute muscles. So what I tell patients, and if you're a patient that is suffering from disc pain and you've been to spinal decompression, you've been to laser therapy, you're going to probably keep going back and back. They'll get you out of pain somewhat, but it's not going to really help with further occurrences because they're not addressing the cause of the problem. You don't have to go in daily, 3 times a week to a chiropractor's office anymore. That's what I guess I want you to understand, that if you get the right home therapy, You don't have to take time out of your busy schedule. You can get the therapy from home. So I'm going to go back to Nicole because she had a really interesting story. Uh, about, I'd say about 18 months ago, she fractured her ankle and it was bad. And she had to have surgery and they put plates in. And so I have been very successful with our art neurological therapy and doing post-surgical rehab. And so I was telling Nicole, listen, we can do that here, and then we can get you set up with the PRS to do it at home, so you don't have to come in here as often. So through the month of November, she was doing great. She actually committed, and I was seeing her at 3 times a week, and then she was using the PRS unit at home. December comes around, and she doesn't come in. I mean, she's got a business and she just can't. And she felt like, well, if I just use the PRS, problem is she would get home at night, she'd be worn out, and so she wasn't even using the PRS. She has a follow-up visit in January with her orthopedic PA, and she didn't do well on that follow-up visit. And so the PA knew that she was coming to see me for the rehab and automatically just went, well, basically you need to go to PT now. You did it your way, and I believe in chiropractic, but you need to go. So just totally discounted anything I was going to do from a rehab perspective. Never asked me what I was doing. And so she went to PT for one visit. And I'll never forget because she called while she was leaving that PT visit and she was in tears. She was very, very emotionally upset. And, I never thought about it this way, but here she was in physical therapy, open bay, obviously, probably at her worst physically, in a lot of pain because she hadn't, been making it in for our care. And they she just she wasn't doing well, and she was out in front of everybody else, all the other patients, and she's well known in the community, and so she just felt terrible. She didn't want people seeing her like that. She just wanted some privacy. She wanted to be able to do her rehab in the privacy of either my office or in the comfort of her own home. So then she got up to the front desk to schedule. They wanted her to schedule out. And two things just mortified her. First of all, they they told her, "Well, we see your private pay." So now it just announced to everybody else that she was private pay, and that was something that nobody needed to know. Second of all, they told her that if she missed an appointment, there would be a $75 no-show charge. And that just wasn't going to fly with her because there's times an employee calls in sick and there was no way that she was going to be able to, you know, leave her business to go do her PT. She called up and she was crying to our front desk receptionist. And then she goes, well, will Dr. Arkfeld let me come back? And it was like, I didn't even know she was gone, to tell you the truth. I thought just because of the holidays, I never kicked her out. And she came in and she relayed this story to me. And she was so visibly upset that, it dawned on me. There's a whole perspective that patients undergo. And I can tell you from my point of view, very, I am not a patient. I don't want people seeing me at my worst. And there was times when I'd be in my family doctor's office, and I remember a few years ago, I had kidney stones and I was not at my best. And I was at his office and there was people that I knew. And I was like, man, I don't want people seeing me like this. And so I told Nicole, I said, you don't have to go anywhere. You don't have to go back to PT. It's your ankle. So here's what we need to do. We need to come up with a plan that you can come in here and you can still get your rehab going. So we did. We moved her one time a week, and then I gave her a complete plan weekly of what she needed to do at home with the PRS. So she had her instructions, and then every week we would update that. She had a goal that in 2 months she was going on a cruise, and she was very scared she was not going to be able to do that and walk around. And I'll tell you, we had her ready. She had a wonderful time. She went on the cruise and everything worked out well. I could tell you story after story. And, actually, I'll tell you one more story. We had we had a kid named Isaac. Isaac was a junior in high school. It was 2 years in October, and he fractured his collarbone in a football injury. And and Isaac was worried, very worried about losing weight. He had spent hours in the weight room, had put on, a lot of muscle. He was just really worried about being inactive and everything. So what we did is we got him hooked up with the PRS unit for home therapy again. Now there are some benefits. The PRS will also do another setting called blood flow, where they don't feel the stimulation part, and it's just blood flow. So naturally, when you increase blood flow to anything, you're going to have a quicker healing time. So we got him on that, and then we instructed him on how to use the other part, the stimulation, to engage the muscles so that they wouldn't atrophy during the time he was in the sling. So in the 2 week follow-up visit, when they did the re-X-rays, the ortho was absolutely shocked on the healing because of the blood flow situation. They were also shocked because he wasn't losing any muscle. There was no atrophy going on. So he kept using the PRS unit. And actually on ARP Neuro, there is a PRS channel where Jake Cousins, and he does a wonderful job. He takes you through workouts. You can use this home unit in so many ways, and you can have your own little gym with the PRS unit. And that's what Isaac did. Isaac put on 12 pounds of solid muscle. His mother bought in. It was like his strength and conditioning coach. And every night he had a different regiment that he would do. One night it was legs. One night it was chest and arms. One night it was back. And he put on 12 pounds of muscle to the point that the football coach was going like, what are you doing? The strength and conditioning coach was like, am I going to be out of a job? It was amazing. He went on and had an outstanding next season, both in football and in baseball. And I mean, the kid walked in one time and I hadn't seen him because we really just got him doing everything from a home point of view. I guess I was seeing him about one time a month just for an adjustment and to check up on him. And he came in one month and it was like, boom, we had this scrawny kid that started off and now he's just got this muscle. So what I'm trying to convey is that no matter what you have, there is home therapy options for you that is now cutting edge technology. It's the same kind of technology that pro athletes will use in their recovery. And that's probably why you haven't heard about this, because they were kind of keeping it on the down low. They're keeping it a big trade secret. And now it's finally getting out. And so you do not have to go see the doctor as many times. You would not have to go to PT as many times. And I know I'm going to have other chiropractors. I'm going to have PTs that do not have this technology, and they're going to be mad. And, I don't care, because it's about you. It's about what you need to get done. It's about your quality of life. And it's about you getting back to doing what you want to be able to do, all in the comfort of your own home. And that's one thing I would say that COVID really taught me, is that we had to do a better job of home exercises. So I just wanted to take this time today and do this live stream and just kind of educate you on what is available out there, what you can be able to do. So if you have questions regarding this, you'll see at the bottom here is my email, ted@neurowaytopractice.com. Please send me your questions. If we need to, we'll set up a time. We'll have a little video conference. I can go over more things specific regarding your condition and see if this is going to work for you. I will tell you that plantar fasciitis, lights out. Discogenic pain, disc problems, chronic pain, unbelievable. If you are in post-surgical rehab, and the other thing too that I found is that we had a lot of patients that had gone through PT and they after a surgery and they were still in pain and nobody could explain it. And it's very simple. The orthopedic surgeon, they go see them. The ortho said, you know what? It was a great surgery. I got the bad anatomy out there. It was a success. They'd go to the PT, and the PT would say, well, you know what? I don't know. I don't know why you're still in pain. Well, one of the reasons they're still in pain is because they were looking at it from an orthopedic standpoint, and we look at it from a neurological standpoint. And we could do a video conference. I can ask you questions. I can even take a look at some of your movements and tell you exactly what's going on. And then we can get you sent the unit and have you start on doing the home therapy. Chronic pain does not have to be chronic pain. It's all about stimulation. If you're in chronic pain from post-surgical, it's because they're not looking at it in the right direction. And we have rehab specialists that will work specifically with you. You will hear from them every single week. And if you have questions, you can email. But it's like having your own personal trainer every week come to you either via Zoom or Google Meet, and you get to ask them questions. They'll show you how to do exercises. They'll show you about the pad placements. It's great. It's absolutely great. There is also one last thing. See, I get pretty excited about this because in 36 years of practice, I've never seen anything like it. I could tell you story after story about what patients would call miracles. Well, now I need to get more people doing this at home. To be quite honest, I tried educating orthopedic specialists about it, and they didn't want to hear about it. They really just didn't. They were really set in their ways. And so I figured there's more people that are in pain than there are orthopedic specialists. So I thought, why don't I do a live stream and come to the people and see if this is something they would be interested in. And so that's why I'm doing this. So again, reach out to me, ted@neurowaytopractice.com. And the only thing you have to lose really is the pain and increase your functional activity. So thank you so much for being here today, taking time out of your busy schedule. And I hope you send me an email, and I hope we discuss things further in the future. Have a great weekend coming up. Take care.